Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about dandruff and drinking water. At first, this sounds too simple. You may ask, Doctor, can drinking water really help dandruff? The honest answer is this: drinking water is not a direct cure for dandruff, and it will not replace proper scalp treatment when dandruff is caused by yeast overgrowth, seborrheic dermatitis, eczema, psoriasis, or irritation from hair products. But hydration can still matter. Why? Because your scalp is skin, and skin depends on a healthy barrier, balanced shedding, and enough internal fluid balance to function well. Look at your scalp as a living surface, not just a place where hair grows. The outer layer of skin, called the stratum corneum, acts like a protective wall. It helps reduce water loss, blocks irritants, supports the skin microbiome, and controls how skin cells shed. In dandruff, that outer layer often behaves poorly. The skin cells may shed too quickly, the barrier may be more fragile, and the scalp may become itchy or flaky. In many people, dandruff is linked to malassezia, a yeast that naturally lives on oily areas of the skin. This yeast can break down scalp oils into fatty acids that irritate sensitive skin. That irritation can lead to scaling, itching, and inflammation. So where does water come in? Ask yourself this: if the scalp barrier is already stressed, what happens when the body is poorly hydrated? The skin may become drier, less flexible, and less comfortable. Drinking water does not wash flakes away from the inside. It does not kill yeast, but it can support the basic environment your skin needs to repair, shed normally, and tolerate treatment better. Start with the medical truth. Dandruff is usually not caused only by not drinking enough water. If someone tells you, just drink more water and your dandruff will disappear, be careful. That is too simplistic. But if you are underhydrated every day, drinking more water may reduce dryness, tightness, and irritation that can make flaking look worse. This is especially important if your scalp feels tight, your lips are dry, your urine is dark, yellow much of the day, you drink mostly coffee or alcohol, or you work in heat, exercise heavily, or sweat a lot. Pay attention to the difference between dandruff and dry scalp. Dandruff often gives flakes that may be white or yellowish and can be associated with oiliness, itch, and sometimes redness. Dry scalp tends to feel tight and may produce smaller, dry flakes, especially in cold weather, after harsh shampoos or after overwashing. But these can overlap. How do you know which one you have? Look at the pattern. Is your scalp greasy 2 days after washing? Are the flakes clumpy or oily? Is there redness around the eyebrows, nose folds, ears, or beard? That points more towards seborrheic dermatitis. Is the scalp tight after washing, with fine flakes and no oiliness? Dryness and barrier irritation may be bigger factors. Now, let's go deeper. Your skin barrier is partly about water, but not only water. It is also about fats, proteins, pH, and cell turnover. The outer skin layer holds water using natural moisturizing factors. These are small molecules inside skin cells that help retain moisture. When the skin is dehydrated or stripped by harsh cleansers, these systems do not work as well. The result can be more itching, roughness, and visible shedding. Drinking enough water gives the body what it needs for normal physiology. But to keep that water in the skin, the barrier also needs healthy lipids and gentle care. Do this. Think of hydration as one part of scalp recovery, not the whole plan. If your dandruff is mild and your scalp also feels dry, improve your water intake and adjust your washing routine. Use lukewarm water, not hot water. Avoid scratching hard. Avoid aggressive scrubs on the scalp. Choose a gentle shampoo on non-treatment days. If you use anti-dandruff shampoo, let it sit on the scalp for the time recommended on the label before rinsing. Why? Because many medicated shampoos need contact time to work. Common active ingredients include ketoconazole, selenium sulfide, zinc pyrithione where available, salicylic acid, coal tar, and cyclopyrox in some prescription products. These target yeast, scaling, or inflammation. Drinking water supports the terrain, but medicated shampoos target key drivers. If your scalp is very inflamed, painful, thickly scaled, or not improving, see a clinician or dermatologist. You may need a different diagnosis or a short course of prescription treatment. Now let's make drinking water practical. Do not force extreme amounts. More is not always better. For most healthy adults, a good starting point is to drink regularly enough that you are not thirsty for long periods and your urine is pale yellow most of the day. Your needs change with heat, exercise, body size, sweating, fever, vomiting, diarrhea, pregnancy, breastfeeding, and certain medical conditions. Start with a glass of water after waking. Drink another glass with meals. Keep water near you while working. Add more when you sweat. Ask yourself, am I drinking because my body needs it, or am I ignoring thirst all day and trying to catch up at night? If plain water feels difficult, add flavor without turning it into a sugar drink. Use lemon, cucumber, mint, or berries. Eat water-rich foods like oranges, watermelon, cucumbers, soups, and yogurt if they fit your diet. But keep the message clear. Hydration is not only about chugging bottles, it is about steady intake throughout the day. Pay attention to your whole skin. If you are dehydrated, dandruff may not be the only clue. You may notice dry mouth, headaches, constipation, fatigue, dizziness when standing, or darker urine. In the emergency department, dehydration can become serious, especially in older adults, infants, people with kidney disease, people taking diuretics, and people with vomiting or diarrhea. If you have confusion, fainting, very low urine output, chest pain, severe weakness, or signs of heat illness, get urgent medical care. Now, how can drinking water help the scalp specifically? First, it supports normal skin cell function. Skin cells are constantly forming, maturing, and shedding. When the body is well hydrated, the skin is better able to maintain its basic structure and flexibility. Second, hydration supports barrier comfort. A better hydrated barrier is less likely to feel tight and itchy. Less itch means less scratching. Why does that matter? Scratching damages the barrier and can make flakes, redness, and irritation worse. Third, water supports normal circulation and nutrient delivery. The scalp, like all skin, depends on blood flow to deliver oxygen and nutrients. Drinking water does not act like medicine, but dehydration can work against normal tissue function. Fourth, hydration can make treatments easier to tolerate. Some anti-dandruff shampoos can feel drying, especially if used too often or left on too long. If your body is already underhydrated and your scalp care is harsh, the scalp may become more irritated. Do this. Use treatment shampoos as directed, not as punishment. More burning does not mean better results. If a shampoo causes severe irritation, swelling, blistering, or worsening rash, stop and seek medical advice. Let's also discuss what drinking water cannot do. It cannot remove thick scale by itself. It cannot treat psoriasis. It cannot diagnose fungal infection, eczema, allergy, or seborrheic dermatitis. It cannot reverse an allergic reaction to hair dye. It cannot replace medical care if there is hair loss, pus, bleeding, painful sores, or swollen lymph nodes. Pay attention to these red flags. If the scalp has open wounds, crusting, spreading redness, fever, patchy hair loss, ring-shaped lesions, or severe pain, get evaluated. Children with scaling and hair loss need assessment because scalp fungal infection may require oral medicine. Ask yourself another key question. What is making my scalp barrier angry? Look at hair products. Gels, sprays, oils, fragrances, dyes, and leave-in products can irritate or trigger contact dermatitis in some people. Natural oils are not automatically safe. Heavy oils left on the scalp may worsen greasiness for some people and may not be ideal when yeast-related dandruff is active. Look at washing frequency. Some people worsen when they wash too little because oil and scale build up. Others worsen when they wash too much with harsh shampoo. Find the balance. If your scalp is oily and flaky, washing more regularly with the right shampoo may help. If your scalp is dry and tight, gentler products and less heat may help. Now add water as a structured habit. For the next 2 weeks, do a simple scalp and hydration check. In the morning, drink water before coffee. At lunch, drink water before you feel very thirsty. In the evening, drink enough to stay comfortable, but do not overload right before bed if it disrupts sleep. Track your scalp itch from 0 to 10. Track flaking on your shirt or pillow. Track what shampoo you used. Track stress, sleep, and weather. Why? Because dandruff often fluctuates. If you do not track, you may blame the wrong thing. Stress and sleep matter too. Dandruff and seborrheic dermatitis can flare during stress, illness, and colder, drier weather. Hydration will not erase these triggers, but it is one stabilizing habit. Pair it with sleep, gentle cleansing, and evidence-based scalp treatment when needed. Keep your expectations grounded. You may notice less tightness and itch before you notice fewer flakes. You may need several weeks of consistent scalp care to see a clear difference. Be careful if you have heart failure, advanced kidney disease, liver disease with fluid retention, low sodium problems, or you take medications that affect fluid balance. Do not suddenly increase water intake aggressively without medical guidance. Pregnant people, breastfeeding people, athletes, older adults, and people working in heat may need individualized advice. If you take lithium, diuretics, or certain blood pressure medications, fluid balance can affect medication safety. Ask your clinician what is appropriate for you. So the take-home message is balanced. Drinking water can be beneficial for dandruff when dehydration, dryness, itching, and scalp barrier stress are part of the picture. It supports skin function from the inside, but dandruff often has other drivers, especially yeast activity, oil, inflammation, and sensitivity of the scalp barrier. Treat the cause, support the barrier, and hydrate steadily. Start simple today. Drink water regularly. Use a gentle routine. Choose an anti-dandruff shampoo if flakes persist. Stop harsh scratching. Watch for red flags. And if it does not improve, get a professional evaluation instead of guessing for months. Take care of your scalp like you would take care of any other part of your skin, with patience, consistency, and respect for what the body is telling you. I'll see you in the next topic.